The broadcast is now starting. All attendees are in listen-only mode.
Hi, everyone. Thanks for joining us today for the March Infoshare. Can you see my screen okay? You should be seeing the agenda. Within the agenda, we've got a lot of information. Why? Well, a lot is going on. All right, so yeah, you guys can see it. Thank you for chatting in to me. So I just wanted to let you all know, first of all, that the next provider info share that we have is March 21st, and although the special topic is to be determined, most likely, it's going to be about COVID flexibilities fading. Okay, so that's probably what's going to be on the agenda. Highly recommend that you come, and please encourage other providers to attend so that we can continue to grow that environment to be able to share information for all providers. Your role in spreading the word has been incredibly helpful. So thank you for doing that. So we also released, we kind of gave you guys the open door to go into the academy. Thank you for signing up. We quadrupled our numbers of enrolled students within like 15 minutes of sending you that email. So obviously you all are on the spot, are Johnny on the spot on responding to emails. So we're excited to have you in there. Speaking of using the Academy, we are going to be having our March CEH regarding the recertification changes through the Academy. That's going to be our first class that isn't prepared before you went in, and it's going to be your first CEH that you can take on demand whenever you want. How cool is that? So what we'll do from that is we're going to get, we'd love to get some of your feedback. So we may ask you about that in the April info share, okay? So be prepared for when that gets launched if you take it, and just some of your feedback on that would be very appreciated. So that takes us to the Full Lives Conference. What's going on with that? Well, it is a live conference face-to-face in Anchorage on the 3rd and 4th, and you can register with the link that's in this agenda that Kat is going to be sending out today. It'll shoot you right into that, and then from there, if you are interested in doing this as a virtual conference, it's the same price as going in person, okay? It's going to be the same price. And the only way we could make it virtual was to have the conference recorded, and then we will have to have those video recordings edited and converted into courses through CHD. And they will post that, and you will then be able to take those classes. If you want to go in person but cost is a barrier, please connect with the CHD and the conference organization for travel funds. They may be able to assist you in attending in person. What happens with your training renewal and CEHs? So we're going to make this really simple, well, as simple as we can. Essentially, if you pay to go to the conference, you're going to be enrolled into a class in the academy that's going to start after those recordings post, and then you'll have to complete some activities and assignments, and then you'll be able to get both your 16 CEHs and your renewal training just by completing that academy process. So we've had a lot of experience of like doing the renewal and then doing the CEH or vice versa. We're not doing that this year. If you register and pay to go to the conference, then you complete the assignments in the academy, you will then get those credit for both. Okay, so the key here is you have to pay to go, all right, and then decide what works for you. So after you do that, we'll then you'll have access to the recordings for a limited period of time. We'll close the class and you'll be informed of when that's going to happen. But once you complete the activities, you'll be able to print the certificate anytime. Okay, so you'll be able to hold on to it for as long as you need to and print it as needed. So,
Delight,
yes,
there's
Cassandra.
still the option for those that don't want to do the assignment, they will still get the 16 CEHs. But they have to register for the training. They have to register for 4 lives, and they will get the 16 CEHs for attending 4 lives. But if they chose not to do the assignment for the renewal, that's okay.
Okay, we'll make sure that we have the messaging down because we'll make sure that it's crystal clear what you have to do, okay? But we want to make it as simple as possible for you to be able to get credit for participating in this awesome conference, okay? It really will be exciting, and it'll be exciting to be able to see people in person. So, have you been getting all of these e-alerts? I believe Kat's been forwarding them to you. So yes, you have, like many, many times. Today's Infoshare is going to be a slow walkthrough of that content, starting with our guest speaker, Rodney George. He's here to talk to you about, and Heather Cord. I see she's coming on board. Both Rodney and Heather are Health Program Manager 3s for NFLOC and ICF IID teams, and they're here to talk to you about short forms. So go ahead and take it away, guys.
You are muted, Rodney. We can't hear you. Oh, no.
Okay. What about now?
We can hear you now.
Okay, great. It muted me automatically, so I was hoping it would unmute me automatically. Apparently it did not. So anyway, thank you for being here and allowing us to quickly talk to you about the upcoming, probably you've heard about, permanent short form that's going to replace what you have all probably been using at least a bit of, is the AppK support plan renewal form. So this one is going to be, one of those flexibilities made permanent. And we have started the process of a pilot group that is going to kind of use the form and test it out for us. I believe we actually have one in-house right now that I haven't actually looked at. But how it's going to roll out is this form, the AppK form, and please correct me, Heather, if I misspeak. The current AppK form is going to retire officially as of July 1st. Any plan with a start date of July 1st or later will not be able to use the AppK form. So we'll have it out early enough so that you'll be able to start working on your support plan renewal prior to that date. But how we're going to look at it is any support plan that renews July 1st or later no longer can be on the current AppK renewal form. It will either have to be a full plan, or it can be, if you meet certain guidelines and you want to, it's not required to use this form. You can do full support plans all the time if you and the recipient so choose, but you could start using this one for any plan starting on July 1st. And again, we're testing it. We're rolling it out now with some volunteers that we had, care coordinators. And so the guidelines on when you can use this form are going to be that it can be filed for 2 renewal cycles in a row, but every 3rd plan has to be a full support plan in Harmony. So for example, if you have a recipient that you have done AppK renewals on for the last 2 years, unfortunately, you won't be eligible to use this one right away. You would be required to do a full support plan in Harmony first before you could use this one. But then the 2 years after that, you could choose, if you wanted to, use this new short form support plan. So that is kind of the rules around it, and then it's for, just like the AppK, it's for plans that you're renewing with no service changes. We do have, you'll see the form eventually. There's some spots on the form that you can update us with some information, and some of it is some required information that we need on the form to meet our performance measures for CMS. So there's a couple of questions on there that We require that new information every year. But if no service request changes are being made and you've done a full support plan in the last 2 to 3 years, you could use this form for renewal 2 times in a row and then do another full plan. Hopefully I didn't botch that up. But the form is in Harmony now. You might notice it. It's called test-support plan renewal-short form. So unless you're one of the care coordinators in the pilot group, please don't submit a renewal on that form just yet, but it will be available to you very shortly. We'll probably put it out, I don't know if we have it a good 30 to 45 days prior for everybody to be able to use to start working on that support plan that would be due, that has a July 1st or later start date. But we hope it goes smooth. I think we're good on that. And we've got a lot of good care coordinators that graciously decided to help us out with this. So we're excited about that and to see, how it goes over the next 90 days. Heather, anything that I missed or misspoke on? Please correct me.
No, you didn't misspeak at all. You nailed it. I was just going to say, it might change a little bit based on our feedback from our pilot group. So that's why we say, even if you see it in the system, just leave it be because things could move around and change a little bit based on the feedback that we get from them. And we're working really closely with our wonderful training unit and our CC liaison to make sure that the rollout is really smooth. So there will absolutely be future opportunities for training for you guys on the form. And that's all I had to add. Thanks.
Hey, Delight, anything else, or Kat? I'm sure
Kat
will be on there. I think that's not what we said, and then I'll have to correct something, and we'll get it all figured out.
You're good. You're good.
Oh, you're
There were a
good.
couple of questions about what does it look like, and can we get a sneak peek preview, and can it be available, at least 45 days ahead, so that folks can make determinations if they could use it or if they have to do the full plan. So stay tuned for more communication about the new short support plan form. We need a better name for it. For the new short support plan form, doesn't even roll. But no, thank you guys for coming. And if anybody has questions, the questions could go to me or training, and we'll send them your way, guys, Heather and Rodney. And if we haven't introduced them properly, Heather is the unit manager of the IDD unit. So she oversees IDD, ISW, the DD eligibility, DD registry. And Rodney oversees the other review unit, right? So you review the NFLOC plans and PCA plans.
So with their powers combined, they will help you make sure this works, okay? Like, we want this to succeed. So we really do thank our pilots for participating and the great feedback we've already gotten on instructions. What can you expect? Like, what can you expect is coming? We will probably be fading that paper amendment form, okay? Like, we don't have the logistics mapped, but that paper amendment form that you've been using, that's gonna go away too. What else can you think about for preparing yourself? Well, if you put in a full plan, you'll be able to use that short form sooner rather than later. Something to look at when you're doing amendments, or if you have the time to do an amendment and do a full amendment, that may make it possible for you to use this short form. So just kind of looking at what you have going on. Some great commentary in our chats. There's a suggestion of calling this the shorty form, which would be pretty great.
I like it.
Yeah, cat sold. Yeah, so we're looking at, so one of the questions, are we saying that amendments can be done in lieu of a full support plan? I'm not quite sure if we mean that we need to do, right now it's possible for you to use the, I believe it's the Unio 3. It's a paper amendment form that you can turn in to make changes in an amendment. You have to add plan services. When we say that a full plan, it could be a initial renewal or amendment, but a full plan means plan services are entered, plan details form, the big form with all of the narratives entered, and if necessary, needs and goals. So when we say full plan, we don't necessarily mean plan type. We mean that all of the narrative is complete and updated so that we can get a good understanding of where this person is in their care, what's changed in their life over the course of the pandemic. That's why Rodney's saying it's not really going to be on the table to have a sequence of APKs that really don't give us the narrative explanation of where this person is before we add that short form. So we need to get an understanding of where this person is at this time. Kat, are there any other chats?
No, I think you pretty much touched on it. There's some questions about why this flexibility will not continue after the PHE ends. I don't know if you guys want to answer that. Why we will be discontinuing the AppK?
This is a good
Sooner.
time. So this is a good time for me to kind of to lay down the foundation here, okay? Remember, throughout the course of the pandemic, we've told you we were going to be really clear when things are starting to fade out. And we are at that point now where we're going to start doing significant messaging on what will change back to past practices, what will change to a new practice, and what will stay the same, okay? So the timing of this is really contingent on our relationship with CMS and what we've agreed with CMS. The May 11th date that you see over and over again is tied directly to the PHE. When it ends, May 11th, a sequence of different services and flexibilities, ways that were different than how we originally agreed to do them with CMS, are going to have to stop. Most of those are having to stop because they're related to PCS somehow. That PCS is like a hard line. If it's related to that, it's going to change back. So as we walk through the e-alerts that we're going to talk about, there are some where paying attention to, does this impact PCS or does this impact waivers, going to be really critical to kind of sort through this. So May 11th is a big day. And then the next really big day is November 11th, when all other waiver associated flexibilities have to stop. SDS can make the call at any time to stop doing specific actions that they had flexibility on doing. We've decided that it will be better to transition the AppK to the short form across this time frame versus trying to stack everything at the end. Okay, so we've made that call to do it at that June, July point. That's where we're going to start focusing on short form use. All right, so hopefully that gives you a little bit of context. As we progress through the pandemic, really the key that is important is that you ask questions when you feel unsure of what is or isn't an impact to your client. If you feel like your client's being impacted by a change, you need to reach out to us so we can help figure out, what can we do to help you transition, okay? So make sure that you communicate your questions and that you're not in this alone. We want to make sure that we transition as smoothly as possible. And that's why we're walking through all the e-alerts that we've gotten out to you in the past 2 weeks or so. Kat, do you want to kind of talk about, is there any questions or comments that you think?
Yeah, I was just gonna say I think we covered all the questions for Heather and Rodney. Thank you guys for coming. You could stick around and listen in or be in the background. It's really up to you guys, but thank you.
We appreciate you.
We've forgotten some of the e-alerts, and there were so many. I feel like there was like one, couple of them a week. So there was the e-alert on the new short support plan form, which we just talked about. The next e-alert was on the guidance on legally responsible adults providing services, and this is where what Delight had talked about earlier kind of comes into play. So for waiver services, so any waiver services that we had allowed the parents, spouses, other guardians to provide services, that will end November 11th. So there's still some time to kind of plan for transitioning that. For PCS and CFC services, that ability to provide services will end on May 11th. So anybody providing chore, which is a CFC service, that ability will end May 11th for them. And we'll have more kind of information for you guys. We're going to have some FAQs and more guidance regarding that. But this is kind of a big date. That's 2 months away. It's about 2 months away. So you need to kind of make sure you're tracking who's maybe a parent or a spouse or other legally responsible person providing a service that's not in the guardianship documents, right? Because guardianship documents are different. Guardianship documents could provision for that, and that flexibility won't go away and that ability won't go away. But it's for individuals who do not have guardianship order or some kind of order allowing the guardian to be a paid provider. The other e-alert that we issued was the guidance on attestations and the use of electronic signatures. And there's a director's memo in there, so I could resend it to you guys if you need. We didn't hyperlink it in the agenda, but if you are able to find the director's memo on our website, do that. The light's going to show us where it is. Hopefully it's uploaded there, right?
It is.
So we've been accepting attestations for a long time now, and that's been great. And we have seen an increase in electronic signatures, and now basically we will be, electronic signatures are accepted. So you can submit things with electronic signatures, and that e-alert that the light's pulling up will kind of give you more guidance on that and what that would look like and what is considered electronic signature and what is not considered electronic signature. And if you have questions about that or specific questions on a plan or a specific situation, just reach out to us and let us know, and we'll respond to you. And I need to move things around to see what the light, because I see things
I'm showing the director's menu or the director's memo. So sorry, I'm just trying to accompany your conversation.
And the last e-alert that we had sent regarding flexibilities was for medical documents, right? So we've been accepting renewal applications for all waivers, maybe without all the medical documents that would typically be required, like VODs or QDCs, but that flexibility will end on May 11th. So any applications that you submit after that date, not for applications that are due, but any applications that you are submitting after May 11th should include all the required medical documents or any updates that you have. If you're having a hard time getting updates from or getting documents from the providers, and you have kind of given them enough time, I'm not talking, you call them today and expect them to send it to you today, but if you have given them ample notice and ample time and kind of followed up, and you're still not able to get those documents, then I think we've sent an email about that, Delight, right? You should do a CIR, which is a QA report, and report that provider and kind of include as much information in that report as you can, when you requested the documents, how you requested them, how much time did you give, did you do any follow-up, all of that. And I'll be sending a follow-up kind of to you guys as one of my info blast emails, and I'll include a little more details about that. And I think that's all the most important e-alerts that we've had. Like I said, we are working on the FAQs for the transitioning out of the COVID flexibilities. And I know we had the MERP presentation during the last Infoshare, and we are finalizing. Guys, this is a process. It takes time to get things done. But we're finalizing the FAQs for you, and I should have that to you by the end of this week. I don't know if there's any questions. The light.
There are quite a few questions.
Yeah.
So let's go up, and we really appreciate your questions. We may not have answers for them today, but I'm just going to put them on record so all of you know. I'm just going to say them out loud so that people know that the theme is here. So big questions on legally responsible persons receiving services, specifically about the legal documentation that it's allowed, like what court orders would be allowed if like it's a child, what would substantiate that they have that's part of that it's appropriate for them. Those are great questions. We don't have answers for you on those kind of details right now, but we can look into it because you need to know. So we can add that as a factor to preparing frequently asked questions of what would be an appropriate document. It may be that we direct you to a saga or other, or maybe even, we may just have to defer you to someone else, but we're going to make sure that you have a warm reception. Okay, we'll prep you for those kind of questions so that you can go to the correct people for it. The next big question that I saw related to documentation, or excuse me, to medical records was how long is enough time to, how long if I put in a request to a medical provider and they aren't responding, like what would be appropriate? How far ahead should I have to put in my documents? What do you think, Kat? Like what would be a reasonable time frame?
I have heard of some places requiring 30 days, and I'm not going to name them, but I have heard, especially hospitals and bigger places have wanted more time. I think we did issue a director's memo regarding medical documents being free, right, and not having to pay for them. And I think that memo talks about, I don't know if I want to say 5 days or so. I think it's encouraging the provider to send the records within 5 days. But I would say, when your applications are due. So for applications, you kind of plan ahead. And if you are able to give them 30 days, I think that's great. I don't know that that's always possible, especially if you have an assessment happening right now and the nurse assessor is asking for additional documents. That's a little different because that turnaround time is much, much shorter, right? But I want to say, I don't know that we have a defined time. I think a week.
I would suggest I would do a minimum of 2 weeks. Like that's pretty cutting it close. It does take a long time for administrative assistant, to just pull that content together. 10 business days would be a good, worst, like last minute kind of request. Your best bet is to give yourself a full month, 45 days. That's not a bad bet to put in for that. There is the instance of where, you've pulled all those medical records, but then time has passed and then the assessor is saying, hey, can I need some more updated medical records. That is fairly normal. The assessor is going to work with you and understands that this isn't a turn on the dime kind of request. They know that it does take some time to obtain that information. And if you're encountering roadblocks to getting that information for the assessor, please work with them and let them know that. You can only do what you can do to substantiate, but you do have to make the ask. So, asking the provider for the documentation, they don't provide it. Let the assessor know that and let them know that that's where you're at. It does happen just based on, we're working with people with very fragile medical conditions, and a lot can happen within 30 days, within 6 months. It's a very commonality for that to happen.
And some of the comments to light about the time frame is ANMC and South Central Foundation typically do 130 days. Maybe I was being ambitious when I said 5 days, but
Well, if you're looking at a small practice, it's possible. But when you're working with these really large entities and you're trying to talk to Providence or, FMH, like they just have a lot of requests coming in for
Well,
all sorts of reasons.
Delight and Cat, it looks like someone has put in here talking about some of the regs are asking where things are supposed to be back within 5 days. So
yeah, that's the director's memo that we had issued. I thought that director's
Yeah.
memo in it said to return them back in 5 business days. I think we have to remember that that memo was pre-COVID, and we are, we have some staffing shortages everywhere now. So I think that would be great, but I think it's not uncommon to see those turnaround times take longer because everyone is short-staffed, even and especially medical clinics, I think. So, but if you see time and time again, if you have issues with the same provider, let me know. I mean, definitely do a QA report, but also let me know and loop me in so that maybe I could track that on our end. I'm not sure that we'll have a solution for you, but it'll be certainly good to know so we could maybe do some follow-up with leadership on that.
And it may be that we need to update that content. I wouldn't say that would be a priority content update. What really our priorities right now is being really clear with you about the flexibility transitions that are occurring. So just know that when May 12th hits, those applications need to have their documentation. So please look at your caseload and look at who you're reapplying for and get those QDCs, those VODs, or those substantiating documents that really demonstrate where your client is today in their care. Okay, so kind of going back, we
I'm
really
trying to go through the questions. There's a lot of questions and comments about the medical documents, and there's some comments about providers are sending bills for those medical documents, and I guess the best I can do is defer them back to that director's memo that talks about, not requiring billing for those. And I think, I mean, I don't even know if you could do a QA report on that. Delight, could you? Would you?
you could.
Supposed to.
Remember that, so when we say QA report, the CIR system, okay? Like we say QA like with something different. It's filing a CIR. And in that CIR, you're filing a quality assurance report because these are Medicaid providers and they are offering services. You working with them and requesting that is a service. So if they're not delivering a service in accordance with their requirements, we do need to know that. And we do need to know it has a cascading effect, as you know, because if you don't have their records, you can't get through the assessment, you can't move on, and then our level of care is lapsed. And so we do need to know. And, we get that it's cumbersome to do those CIRs. We do understand, but it really does help give us a picture of where we may need to work on doing some collaboration with providers. Okay, so please let us know. Looking at other comments, let's see. We do appreciate all your feedback in it. We're just trying to catch up. You guys had a lot of thoughts all at once, so something really resonated.
Well, the medical documents issue has been an ongoing issue. I'm not sure that it was not an issue before the pandemic. I think it was different, but it certainly was an issue. So.
Okay. All right.
I think we covered.
We
If
got
we
a lot
missed
of
something,
content
we'll certainly go through our questions after, and if we need to do some follow-up, we will do that.
All right. So this one is not a fun conversation, but we've had a large uptick in it, enough that we are worried about our interactions with each other. And we wanted to spend just an acknowledgement that we are all in this together. And what has been happening? Well, there's been instances where maybe the transfer between care coordinators did not go smoothly, where there was billing conflicts, or perhaps a care coordinator put in an application or a support plan that really didn't meet the person's needs and billed for it. I'm not saying, and I know everyone out there is like, are you talking about me? I'm not trying to stir anything up. What I'm really trying to do here is to acknowledge that we do really need to work together and facilitate nice, like, I won't say nice, but let's just say professional engagements, because Alaska's really small and we need to be working together to make plans for, when I say plans, I mean like between providers on how to transfer a case, and that includes the billing component. So what we would really wanted to do is just acknowledge that we are seeing that, and we are a little disappointed. I'm a little disappointed that, and that's my mom voice coming out. I'm a little sad that we're having these kind of interactions where maybe we didn't meet the client's needs and just filed an app K and billed for it, and then the new care coordinator has to do a full plan in Harmony, and they're not going to be able to bill for it. That really makes a hard job even harder. And I know that it all comes back to the golden rule, everyone, like, do to others what you want to have happen to you. So please continue to work together. It is a regulatory requirement as part of your person-centered practice. Can anyone tell me which reg that is? I mean, I'll give you mad credit if you can get it.
I wasn't prepared to like get tested in regulations delight.
Well,
but we'll let
we're just gonna like lighten the mood up a little bit. If anybody can find that reg for me, I will buy you coffee at Full Lives.
Okay, 220-18 delight. Do you know which one it is off the top of your head?
It's one of the last ones. I do. I think it's one of the very last ones, but I'm just waiting to see who's gonna put it in the chat.
There's some feedback. It's on the ACC. Is it 220-18? Is it because it's a person-centered plan and it's about the person, right?
Who's
it's on the ACC.
Somebody's in that reg right now. Like, we'll look through the chat, and whoever gets it, I'm buying you coffee or sending you a coffee card.
At Full Live.
Yeah, that's also my way of getting you to come visit us at Full Lives too, because we know that's
now I'm gonna have to look it up because
Cat can't, like, you're gonna beat Cat, guys. If she beats you, that's an easy win for me, because I can just buy her coffee and be done. Yeah, so, and it is on the ACC, that is true, but I'm looking for the reg. If you can find the reg for me and put it in the questions chat, you get mad credit, and I'll buy you a coffee. So trying to lighten up the like sad mom talk. I feel like I'm talking to teenagers on that. Like, not that I have one, but it's not a.
Oh, hold on, we got some answers. It's on the ACC again. It is on the ACC, guys.
I'm not gonna say, like, Kat is like struggling to find it. Is that it?
I'm looking because I'm trying to pay attention to the chat.
Okay. I mean, I gave you all the hint. With that,
I'm looking at the chat, Kat. You keep looking.
I'm just gonna let's see if it can come up, because I can find it pretty fast.
So
I think there was one that was really close. There was one super close that I see in here, but they got the lead in wrong by one number.
So it's not 120, it's 130.
Yes. Oh, I see somebody may have gotten it.
Yep. So those who said it's on the ACC are right. It is noted on the ACC. It's kind of hidden on the bottom. And it says, if this is a transfer of care coordination, a payment agreement has been developed. And you guys are signing saying, yeah, you guys developed whatever that payment agreement may be. That is
I'm laughing.
beyond.
I'm laughing at
Oh,
everybody trying to pull open all of the
Yep, that's
all
it.
of
You got the
Cat.
answer.
Who's the winner, Cat?
It is KO.
KO. Coffee for you. Are you coming
But
to Full Lives?
people were close. People were pretty. You guys, you know where that information is. You guys know that it's on the ACC. And this is not, I'm not gonna say it's a unique issue to care coordinators because it's not, right? There's an issue with billing with providers and transfers and units and banking and who's gonna bill for what. That happens frequently, right? We don't hear about it as much, but we do hear about it about care coordinators. And this is not necessarily a new issue because it's been going on. I think it's just been an uptake in it to like maybe in the last, I would say, couple of months, like
3
3 or
months.
4 months.
Right.
Enough in the past 3 months that we decided that we wanted to talk with you about it because we believe in you. And so we want to we really do kind of, whenever we get the chance to really bolster you and sing your praises, we absolutely do. And so this is one of those feedback points where we really do believe in you, but we also want to make sure that you're aware that we know when you're being disrespectful to each other. We know. We find out, and it makes us sad because it's not cool. This work is already hard enough.
I'm really sad and disappointed.
Yes, I'm very sad and disappointed in you. I expected better. And I do mean that honestly and truly. So please, and for many of you, you're all like eye rolling me, being like, Delight, this is nothing. Like, I would never do that. But, I'm also saying this for everyone that has been stung by that, having to do a full harmony plan, having to do all of that work, and they can't bill for it. I see you too. I know that's not fair to you. So just wanted to put that out there. Anyways, that's all that we have for you. I do want to give you a heads up. All of this stuff of the May 11th, the June date for short form, and the November 11th dates. We are going to try to make a fairly tidy package for you because it's a lot to track and it's a lot of collaborating and planning with families, and it's a big change to families. And we want to support you as much in navigating that for them as possible, however we can support you with that. So we are going to be giving you resources, and we will be having more conversations about these flexibilities and their changes, or reverting back to past practices so that we can talk through it. I did see so where are we in the process for that? We're within the business week. It's coming soon. At least the first major communication that you'll have a resource for that. I also saw questions that were related to, some of the concepts that are like fading, like natural legal supports. Like, why are we doing all these surveys? Well, we need to have the scope of impact in order to better address how to help with it. So that's why that survey is important. We need to understand
Delight.
how people are impacted.
One of the questions was they was wondering if, since we did send the surveys out, what was the information from that? And I believe Kat answered that, letting them know that it's still out and all the survey or everything is not back in and hasn't been finalized yet. So that was the question along that line.
Right, and if you as a care coordinator got the survey, don't do it. It's meant for providers. I think there were some care coordinators who were on that list that received it. But you could work with the provider agency to make sure that they answer and follow up. But we are still waiting to hear back kind of what that survey had said. I think it was extended. I should probably look at those dates, but we haven't heard back yet. The decision has not been made yet. based on the information from that survey. So, yeah, not yet.
I believe we're
We'll
at
know.
a point where we have a SDS staffer calling everyone that didn't respond just to make sure, like, you're not responding because it doesn't apply to you, because we really need to know how big of an impact this would be. Okay, so lots of additional comments.
A comment about conduit, do we want to answer that or we're not able to answer it?
We really can't speak to a lot of the billing
Yeah.
stuff. We really
Okay.
can't. And it's very tricky because like you make the request to us and then we authorize it, but then you build a conduit. The best resource for questions about conduit is conduit. I'm kind of reading some of your thoughts, and I would concur that we get that we're all pretty tired and COVID fatigue is real, and that some of these scenarios where maybe there isn't the best collaborative energy is kind of stemming from that, and we understand that. I guess our big goal with this conversation is to just bring it up as a topic for you guys to think about and to recognize that we're all a team. we really are, like, in the grand scheme of things, we're all doing this work together and we each have our own piece of the work. But when it comes for making sure someone has continuity of care and a solid support plan in place, and we need to make sure that that's at the forefront of our approach. So with that being said, we still have 12 minutes. And I am happy for you to go ahead if you have more questions to toss them in the chat. That's okay. But there's nothing that says that we have to stay this whole time.
And we could wait a few minutes to see if folks ask questions or if they're dropping out. But if you have questions, now is the time. If we can't get to it today, we'll definitely get back to you with the answer. We need like elevator music, Delight. We need something playing as we're doing this, like, Jeopardy
Like
music.
some
This was a
smooth
couple of
jazz.
questions about transfers. They want a little more clarity on transfers.
Okay.
I'm trying to look back because I'm looking
Yeah.
at a couple of them that are. And, we do really appreciate, you taking the time and giving us a robust discussion point. Like, we really do appreciate it.
Okay, I see. I'm gonna flag one right now.
Okay.
There you go.
So one of the questions is about the saving in Harmony. Yeah, so the saving not working or things not saving your data after you put in a full Harmony support plan. I've recently had that horrible experience and it is not great. So for context for all of you, when you're putting in a full support plan, it's really important that you save frequently and that you keep your original web browser with Harmony active. So if you're not saving within the right timing sequence, because it's 20 minutes, so it's a very short period of time, you also need to be making sure that the Plans tab in the web browser is also active, because if the web browser times out with inactivity, it'll actually pop up a little window on that browser and say you have 2 minutes to do something or we're going to log you out. But because it's all Windows, you're working in a different window and you don't see that little reminder. And it can result in losing a considerable amount of data. We have been working with our teams on what we can do on fixing that specific issue. And at this time, we still do not have a solution for it. So as we previously discussed and resources that we've used is your best thing to do is create your narrative in a Word document. You can use the template that Kat has sent out before that you can fill that in and then paste it in. And then I suggest saving at every section. But yes, we recognize that it is very cumbersome and can cost a lot of time. And we discourage you from creating narrative in Harmony, instead using that Word document to create it. Yeah, it's, I'm seeing your comments, like, it's not great. Yeah, so request for Kat to resend out that template. What else can you expect? We're going to be doing some trainings on how to do a full plan because you're going to need it. We all will. So we'll all need to make sure we have tools for that. And so we're preparing some curriculum to help you be able to get a full plan in Harmony and the best steps to do that. We're working with our teams to make sure that it's the most updated and efficient methods for you to be able to turn in information for us.
If we have time, Dolly, there's a question on Influx applications and requests. I flagged it red. It's this question on the Influx applications. When it says treatment, that is supposed to be a specific treatment, or is it supposed to be with every single medical visit?
I can see how that would be confusing.
Yeah.
So what my best answer today, I know that's never great, but you know, it is pretty case specific. What they're looking for is if you're doing a treatment course to care for someone as part of their diagnosis, that needs to be identified. So you can put down that you have a general practitioner, but what does that general practitioner, why are they seeing them? How frequently do they see them and what are they monitoring for? So in the event that someone has a diagnosis that's based on a TBI and they're having to go visit their primary physician monthly or bi-weekly, whatever their care plan is, it would be sufficient for you to say something to the effect of bi-weekly visits monitoring a TBI. There are other scenarios where you're like, all right, we're having to go in because we have chemotherapy, we have dialysis. And what they're looking for, whenever we're communicating on the application regarding medical contacts, is similar to our thoughts about frequency, like how often do we see them? When we think about duration, it's during the previous plan year, like, you know, like how often are we seeing this person in the past, right? Past years, the time frame we're looking for on medical records. And then, you know, what are they doing? Okay, so how often within the past year are they providing a service to the client that's related to their diagnosis? I hope that helps. It is tricky because every client has a different care plan with their medical professional. But when we're looking on that application, we're really trying to understand the diagnosis, that the primary diagnosis that really it makes the level, it impacts their level of care. It's the reason why they would be institutionalized, because they have such high care needs and their long-term needs. Any thoughts to add to that, Kat?
No, I think you covered it. There's some other questions about applications that I'll be following up with the assessment unit, and maybe they need to be a little more specific, be more specific in the requests. I'll bring that back to the assessment team.
Yeah, so at this point, it's total request live, like what questions you have that we can answer. So if you feel like we're off track, it's because we're in open floor, and I can move our agenda down to that's where we're at. Questions and feedback. We always want to give you time to express what you're encountering. Sometimes this is the venue that we find out about things that we were not aware of as a division until you told us. Okay, so I'm seeing a question about expedite requests in Harmony. That's a great question. Expedites in Harmony there are two paths. One of them is via paper applications, paper expedite form, okay? When you get to your support plan, if your support plan needs to be expedited, it's an expedite Harmony form, an expedite Harmony form. And your T24 has instructions for both, but the best way I can really sum that up on expedite forms is paper application, it's paper expedite form. Electronic support plan, like it's the Harmony plan. Everything right now is in Harmony on those support plans, whether it's AppK or paper AppK, it's going through that support plan like process. You're putting it in a support plan. It's an electronic form. Okay, we're getting close to the top of the hour. And yeah, we're welcoming your feedback still. So we're quiet, we're reading. And one of the great benefits of having a care coordinator liaison is that she's going to Nancy Drew the situation, and she will look into what will happen. She'll pull out her magnifying glass and find out for you. So please leverage that and contact her if you have unique situations or have feedback on a unusual case and you're not sure, was that right? And we can help with that.
One of the last questions is who oversees conduit and who could we call since they're not responding to them? Who should they call?
That's a tricky one. What would I do? I'd go to the conduit site and I'd look up there. As a provider, you do have resources within when you log in. And again, we're outside of what I can teach to. I would go to the the conduit website and look there for contact information. All right, we're at the top of the hour. And
Just a minute left, so last minute questions, I think.
We'll let you
type them in.
Yeah, we'll let you finish typing it in. But as always, we appreciate you. We know your job is not easy and you're working every day with people that really need help. And, we couldn't do what we do without you. And thank you for making Alaska a place that's accepting and driven towards helping people be independent. And without you, we couldn't do it. Please continue to reach out for support as always. We have our office hours. You have our emails. And we'll do our best to help you we'll help transition through the upcoming waters we have ahead of us with these flexibility transitions, okay? We're all in it together and we'll navigate it through. So with that, Please give us time to prepare a recording to post online and to give you an email for your CEHs. We hope we see you in 2 weeks on the 21st, and we'll be in touch, okay?
Thank you, guys.